right. Getting ready for a hospital social worker interview, huh? Feeling a little overwhelmed by all the questions they might throw at you.
Yeah, it can definitely be nerve-wracking.
But don't sweat it. That's why we're here, right? It's diving deep into these awesome resources from RoleCatcher.
They've got this interview guide and career guide.
Think of them as like your cheat sheet.
Not just for acing those interview questions, but for really understanding what a career in hospital social work is all about.
Exactly. So we'll tackle those tricky questions, but also sprinkle in some career insights. Things that'll help you stand out.
Show them you're serious about this.
Absolutely. So first things first, got to paint a picture of what this role is really like.
Right. Day to day, what are you actually doing?
It's not just sitting at a desk all day, that's for sure.
No way. You're interacting with everyone, doctors, nurses, patients, families. It's high energy. Got to be able to navigate all those personalities and needs.
And that's something the career guide really highlights: social perceptiveness.
Being able to read people and situations is just as important as your clinical knowledge.
For sure. Okay, so let's jump into the interview questions, shall we? RoleCatcher's got 9 key ones in their interview guide.
Yeah, we'll break them down one by one.
Give you the inside scoop on what they're really asking.
And how to knock your answers out of the park.
Love it. All right, so let's start with a classic. Tell me about your experience in a hospital setting. Seems straightforward enough.
It does, but they're looking for more than just a list of your past jobs.
Exactly. Don't just tell them you've worked in a hospital. Show them.
Share a story, like a specific anecdote.
Maybe a time you dealt with a challenging patient.
Or had to work with a doctor who, well, wasn't the easiest to collaborate with.
And be ready for those follow-up questions.
Oh yeah, they'll dig deeper into that story for sure.
Like, what was the biggest challenge? How did you handle the stress? They want to see how you think on your feet.
Definitely. And here's a cool tip.
Hit me.
RoleCatcher's AI, right? It can analyze those job descriptions.
No way.
Yeah, and it picks out the skills that the employer really values.
So, let's say this hospital emphasizes patient advocacy.
You could tailor your story to really showcase a time when you went above and beyond for a patient's needs.
Makes sense. All right, next common one. How do you prioritize a heavy caseload? This is all about organization.
Time management, too.
For sure. They want to know you won't crumble under pressure.
Right, so explain your system, however you do it, spreadsheet, color-coded notes, whatever works.
Walk them through it and be prepared for the curveball.
Like what happens when an emergency pops up? Got to show you can adapt, reprioritize on the fly.
And you know what's super helpful here? The career guide's insights on technology.
Oh, tell me more.
So many hospitals use electronic health records and case management software now.
That's true.
So if you've got experience with those systems, mention it. Shows you're tech savvy and can jump right into their workflow.
Great point. Okay, let's tackle this one. Tell me about a time you had to handle a difficult situation with a patient or their family. This is where your empathy shines.
Big time. Got to stay calm under pressure, de-escalate those tense situations.
So think of an example where you really had to navigate a tricky situation.
Maybe a family disagreeing about treatment options or a patient refusing care.
Yeah, focus on what you did, how you listened, validated their feelings, found a solution that worked for everyone.
And guess what? RoleCatcher's AI can help you refine that answer too.
Really? How so?
Let's say the AI picks up on keywords in the job description, like conflict resolution or cultural sensitivity. Make sure your story highlights those specific skills.
Smart. Like maybe you had to mediate between a patient and their family who had different cultural beliefs about medical care.
Exactly. By tailoring your response, you're showing them you've done your research and you get what's important to them.
That's gold. Okay, next question. How do you work with other healthcare professionals to provide the best care for patients? Teamwork.
Huge. Hospitals are all about collaboration. Doctors, nurses, therapists, social workers, everyone working towards the same goal.
You got to be a team player.
100%. They might even ask you to describe a time you had to work with a difficult colleague.
Or how you handle disagreements about patient care.
Yep. And again, that AI can come in clutch. If it flags teamwork and communication as key skills in the job description,
use those keywords when you're describing your experience.
Boom. Okay, let's talk about a question that sometimes throws people off. How do you stay up to date with developments in healthcare policies and regulations?
Don't worry, they're not expecting you to be a legal expert or anything.
Right, but they do want to see that you're engaged with the field, that you're committed to ethical practice.
So mention any professional journals you read.
Conferences you've attended.
Even online communities you're part of. Show them you're actively learning and growing.
And if you can tie it back to the specific hospital, bonus points.
Oh, yeah, for sure. Like maybe they're known for their work in a particular area, geriatric care, palliative care, something like that.
Mention any recent policy changes in that area. Shows you've done your homework.
Speaking of homework, did you know RoleCatcher's AI can even give you feedback on your practice answers?
No way. Like a virtual coach.
Exactly. You record your answers, the AI analyzes them, and gives you tips on how to improve.
That's so cool. Okay, another question that can be a bit tricky. How do you evaluate the effectiveness of your interventions with patients?
This one's all about showing them you're thinking critically about your work.
That you're always looking for ways to improve.
Right. So talk about specific methods you use to track progress.
Maybe standardized assessments or feedback from patients and families.
You want to demonstrate that you're data-driven and focused on results.
And again, the AI can give you an edge here. If the job description mentions specific metrics or outcomes,
You can weave those right into your answer.
shows them you're paying attention to what matters most to them.
Makes you stand out from the crowd.
Totally. Okay, ready for another one?
Bring it on. Okay, how about this one? It can really throw people for a loop. How do you handle ethical dilemmas in your work as a hospital social worker?
Oh yeah, that's a big one, this field. You're going to face some tough situations.
Well.
Maybe a patient's wishes clash with what their family wants.
Oh, absolutely.
Or you're concerned about a doctor's treatment plan.
Right, and they want to know you can think critically.
Make sound judgments when it really matters.
For sure. So it's key to show them you understand the ethical guidelines, those principles that guide social work.
Makes sense.
You know, familiarize yourself with the NSW Code of Ethics.
Yeah, that's like your moral compass.
Exactly. And don't just rattle off the code.
Right.
Think of a real example, an ethical dilemma you actually face.
Okay, so say you had to advocate for a patient who wanted to refuse treatment, even though their family wasn't on board.
Perfect example. Walk them through how you made that decision.
You weighed all the perspectives, thought about the consequences.
And made a choice that aligned with those ethical principles.
Got it. And hey, RoleCatcher's AI can help you prep for this kind of question too.
Oh, how's that?
It can analyze the job description, see if they mention any specific ethical considerations.
Interesting.
So maybe this hospital really emphasizes patient autonomy or end-of-life care.
You could tailor your example to really address those specific areas.
Shows you've done your research, you understand the nuances of their ethical environment.
Love it. Okay, shifting gears a bit. How do you ensure that patients receive culturally sensitive care?
That is so important, especially in today's healthcare landscape.
Absolutely. This is all about showing them you're aware of diversity, committed to providing inclusive support.
Yeah, it's not just about being nice. It's about understanding that different cultures have different beliefs.
About health, illness, family dynamics, even how they communicate.
And those differences need to be respected.
100%. So share some specific things you do.
Like cultural assessments?
Perfect. Or using interpreter services, consulting with colleagues who have expertise in different cultures.
Shows you're proactive.
And be ready for those follow-ups. Like, tell me about a time you had to bridge a cultural gap with a patient or family. They want to see you in action.
Not just talking the talk.
Right.
And guess what? RoleCatcher's AI can actually help you practice for those follow-up questions.
Get out.
It can generate potential scenarios based on the hospital's patient population.
Oh, wow.
So let's say the AI sees that this hospital serves a large immigrant community.
Oh.
You can brainstorm challenges. You might face language barriers, cultural misunderstandings, navigating different healthcare systems.
And then practice how you'd handle those situations.
It's like a personalized simulation. Gets you thinking on your feet.
That's incredible. Okay, one more that's super important for anyone in healthcare. How do you handle burnout and maintain self-care in such a demanding role?
Ugh, yeah. Hospital social work. It can be emotionally draining.
It can.
You're dealing with people in crisis, facing tough decisions, navigating a complex system.
Absolutely. It takes a toll.
Yeah.
And they want to know you're aware of that you have strategies to stay healthy, resilient.
Right. And don't be afraid to be honest. Tell them what you do to recharge: exercise, meditation, spending time in nature, whatever works for you.
Yeah, those are all great.
And remember, self-care isn't selfish. It's how you show up as your best self for your patients.
Totally agree.
And the career guide actually emphasizes this. It says, burnout doesn't just affect the social worker.
It affects the quality of care they can give to patients.
Powerful stuff. So self-care is kind of like an ethical responsibility.
It is.
Not just a personal thing.
Exactly. Okay, we've covered a lot of ground here, but before we wrap up,
Yeah.
I want to mention something else RoleCatcher offers. It's their AI-powered CV and resume builder.
Ooh, tell me more.
This tool is a game changer. It doesn't just help you format your resume, it actually analyzes job descriptions.
Wow.
And it tailors your content, highlights the skills and experiences those specific employers are looking for.
So it's like having a professional resume writer in my back pocket.
Basically. And it goes beyond just keywords. It gets how those applicant tracking systems work.
The ATS, right?
Yep. It helps you optimize your resume so it gets past the robots and into the hands of a real person.
That's huge.
Yeah.
So much easier to stand out that way.
Totally. And the best part, it's all connected to RoleCatcher's other tools.
You mean like the skills the AI says are important in the job description?
Those are the same skills you can highlight in your interview answers when you're using that AI practice tool.
So it's a total package. Love it. Okay, let's zoom out for a sec. Think about your career path as a whole.
Big picture thinking.
The career guide breaks down different career stages, gives you a roadmap for advancement.
Oh, I like that.
You start at the entry level, getting your feet wet, supporting patients and families, collaborating with other healthcare professionals.
Then you move up to the intermediate level.
Maybe leading support groups, doing more complex assessments, even supervising interns.
And if you're ambitious, you can aim for the advanced level.
Program development, policy advocacy, research, clinical supervision.
Wow, so many options.
The guide even gives you example profiles for each stage.
So you can really picture yourself in those roles.
And start thinking about the skills you need to get there.
That's so helpful. It's inspiring to see where you could go in this field.
Totally. Okay, so with all this in mind,
Yeah.
what makes you unique? The guide says there's a growing demand for hospital social workers. But what can you bring to the table that might not be on your resume?
Ah, the secret sauce.
Yeah, like what sets you apart from everyone else?
It's all about those unique experiences, those hidden talents you have.
Right, like it's easy to focus on the basic requirements, but what makes you you?
Exactly. Think outside the resume. You know, maybe you volunteered at a hospice or you've got experience working with veterans or refugees.
Those are amazing examples. Or maybe you speak another language fluently.
Oh, yeah. Huge asset.
Or you've got a background in art therapy, music therapy, something a little different.
Those things make you stand out, show them you bring something unique to the team.
It's all about showing them the value you bring.
For sure. So, as we wrap up this deep dive,
Yeah.
what does all this mean for you as you walk into that interview?
That's the big question, right? What have we learned?
It means you're not just ready to answer their questions, you're ready to tell your story.
I love that. It's about connecting with them on a personal level.
Exactly. You've got the insights to understand what they're really looking for.
And the tools to tailor your answers to show them you're the perfect fit for their team.
Couldn't have said it better myself. And remember,
Yeah.
this field, it's about more than just getting a job. It's about making a difference in people's lives.
It is. It's about being there for them during some of the toughest times.
You're a source of support, an advocate, a guide, someone who helps them navigate this whole complex world of healthcare.
And brings them hope when they need it most.
Absolutely. So go into that interview with confidence.
Yep.
Knowing you have the knowledge, the skills, the compassion to be an amazing hospital social worker.
You've got this.
Yeah.
And don't forget all those awesome resources from RoleCatcher.
Oh, yeah. The interview guide, the career guide, those AI tools, they're your secret weapons.
They really are. All right, that's a wrap for this deep dive. Best of luck out there.
You're going to crush it.
Yes.